I want to start with a little story and an interaction I had with a patient years ago that sort of brought me here, and the reasons why I feel that dental assisting is so important to a practice. Went out to greet a patient in the lobby, his first visit, and reached out to shake his hand, and the first thing he says, he stands up and he says, "Wow, doctor, you must be understaffed today if you're coming out here to greet me." And I said, "Oh, well, my name's Will, and I'm the doctor's assistant." And he actually, before the handshake, put his hand down and relaxed, and he says, "Oh, I see, you're just the assistant." And I thought about that for a second. I said, "Well, just the assistant, all right." So I brought him into the operatory, and we started taking x-rays and getting the patient comfortable, and had the doctor come in. I assisted with the diagnosis, put a treatment plan together, set up the operatory, assisted with the procedure, impressions, temporaries, and released the patient at the end of the appointment. He was there for probably about 2.5 or 3 hours. And when he left, he says to me, "Well, man, I only saw your doctor for about 30 minutes. He says, for just an assistant, you sure have quite a lot of duties." And so that really got me thinking. We run a lot of things behind the scenes in the practice. The dental assistant is one of the most trusted professionals in the dental practice. And the dental assistant works with everybody. The dental assistant works with the doctor, with different doctors, with the hygienists, and different specialties, whereas most dentists work with one dentist their entire career, and that's their self. Patients spend the majority of their visit with the dental assistant. So we're there from the beginning when they're nervous, we're there through the procedure, and we're there at the end when the numbing's starting to wear off and they need to know what the next step is. Dental assistants have a very vast range of duties. We work in most every dental specialty from start to finish, and we do other auxiliary duties such as photography, and I've also done clerical work, and just about everything else. Lab work, it really has a broad range. The dental assistant's duties are ever expanding. We're constantly being given new duties and new things that we're able to do in dental offices to assist doctors. So I put a little graph here. The growing number of patients seeking care is actually outnumbering the volume that current healthcare professionals can handle, and people in general are living longer and they're keeping their teeth longer. This little graph here just shows from now until 2050, the 65 and over population will most likely double, and the 85 and over population will most likely triple. That's not the case with dental healthcare providers. For RDAs, RDAFs, and EFs2, healthcare in its entirety has seen the expansion of duties to auxiliaries. You see how important physician's assistants are now to medical practices. So the dental board continues to add functions to broaden the scope of a dental assistant's practice. This enables us to better serve a growing community. But what does all this have to do with digital dentistry? Well, right now the dental board has approved for RDAs, RDA-EF, and EF2s the ability to scan tooth preparations for CAD mold restorations under general or direct supervision. And there's a cutout right here from the dental board's rules. So general supervision, meaning the doctor doesn't necessarily have to be in the operatory or in the office for the dental assistant to provide the functions, or to direct supervision where the doctor's actually in the operatory or in the office where he can directly supervise and they have complete control over that. Of course, we all know about the doctrine of responding superior, let the master answer. So the dentist at all times is in charge of what duties his auxiliaries are allowed to perform, and it's up to that dentist what they can perform and what they shouldn't, because ultimately they're the ones responsible for what happens in their practice. So I want to talk a little bit about the benefits of doing digital dentistry as a registered dental assistant. So for the Fast Mill, we use the 3M True Definition scanner, and it is very user-friendly, something that an RDA could use. And the interface is similar to how a digital intraoral camera is used. If a dental assistant is taking x-rays and taking photos and using this intraoral camera by sitting behind the patient and learning how to see the camera and the screen backwards, it's pretty much the same with the 3M True Definition scanner. And the Fast Mill saves patient time in the chair, and it doesn't take up very much counter space. And we've got all sorts of dental tools and machines in our lab. One more thing on the countertop, especially this small thing about the size of a microwave, isn't going to take up too much more room. Another thing I like to do, and I've worked in an office where we did this, we actually took the mill and we brought it in on a roller right beside the patient and let them watch it. And that's the best thing too. They can come in, they can see what happens. We even have them bring their kids in or bring their wife in or husband in, and they can actually see the mill at work and see what's going on. And that time isn't wasted. I've even had people film it on their phones and Facebook it. And now some of the block options are actually pre-centered, like the Bruxer Now. So it's already baked at the lab, and it takes out one more element out of the entire procedure. You can mill this crown, take it off the sprue, polish it, and then place it in the patient's mouth without having to wait for the oven. However, you have that option if you'd like to stain and glaze as well. The easy design and the interface requires less of the user. So less time having to design. The machine comes up with its own proposal, and it's less you have to do to actually change it, make contacts and design and things like that. So you scan, the 3M True Definition will design it as closely as possible, and we send it to the mill. So less user interface that an RDA or the dentist has to do. The proposal, the final restoration, requires that minimal adjustment before sending it to the mill. So just a couple tweaks here and there, usually your preference, and we send that right to the mill. And of course, it's less mess and cleanup versus impression-based dentistry. Of course, we're still going to have to do impression-based dentistry when we're talking about multiple units, bridges, cosmetic treatments, but we can eliminate a lot of that patient's nervousness and fear when it comes to taking impressions and dealing with sending things to the lab and putting them in temporaries for a long time. Digital skills increase the asset level that a registered dental assistant provides to the office. And I've seen a lot of times a dental assistant get picked for a job based upon their skill level with digital and with impression taking versus someone that only has one or the other. Like I was saying, the ability to obtain impressions and digital final renderings is highly sought after, and especially in the growing dental world today. So what are some benefits of digital dentistry for the dentist? First of all, an increase in overall productivity. The dentist is no longer going to have to do every single function. They no longer have to prep, pack cord, scan, design, glaze, and stain. And dentists don't have to relinquish all control over the procedure. And that's one of the main things that I've heard dentists say is that, well, I still need to have control over what's going on. If I'm in another room preparing, I don't want my dental assistant just going rogue and doing whatever he wants. One great thing about the 3M True Definition scanner is that the dentist still has password-protected control over the final rendering. So before the dental assistant can send that to design and to the mill, the dentist has full control over taking a look at it, making his last changes, and then password-protected, send it to design and to finally mill. And like I was saying, all dentists always have the final approval over any restoration that's sent to the mill. So as far as costs are concerned, costs are more of a line item shift. You're not really saving money doing digital dentistry, but yet you are spending your money on the design and the software and the mill and blocks that go with it instead of paying the lab to do these functions for you. A couple things to consider when doing digital dentistry. You need to appreciate and embrace the learning curve. There is going to be a learning curve. You're not going to be pumping out 1 hour crowns right off the bat. Start slow and just don't stress yourself out. Stressing yourself out projects to your patients, and your patients can see that you're stressed out as well. We talk about beginning with short-term dentistry until you're proficient with the system. The first couple weeks, couple months until you get comfortable, try scanning and placing your patients in temporaries for a short term, maybe a few days or even 1 week from that appointment. Your patients are still going to feel that benefit from having 1 week or a few days, and you'll get some time to really get used to the system and do things on your own accord and when you're not under pressure. Of course, dentistry as we know it remains the same outside of using digital dentistry. Pre-impressions are still advised until you become proficient at using the mill. For RDA EFs and EF2s who are allowed to pack retraction cords, you still need to pack retraction cords. You still need to use compression caps for retraction. Nothing changes. Proper retraction and hemostasis is always critical on any crown prep. Make sure isolation, saliva contamination, and the powder placement when you're actually scanning is maintained for a good scan every time. So patients feel the benefit of faster service, and the practice can grow slowly into single-day dentistry. So there is something to be said about dentistry after a few days, and there's something to be said about a turnaround of 1 week, let alone just 1 day. If you have any more questions, please visit one of our staff members and talk to them. You can see the mill in action, use the True Definition scanner, and then get involved. So thank you for coming today. I appreciate it.